Yes, so thank you. The farewell for Dr. Fong had been arranged since the beginning of this year, that it will be held in the Western Division, in the Northern Division. It was meant to be an opportunity for us to take a big, high-level farewell function, which we often do for senior officers in the Ministry of Health. To the Northern Division. We've always held these functions in the Central Division, and the Northern have always left out. So in this situation, we've decided that it happens in the North. It coincides with one of our programs that we had discussed since last year of getting our senior officers to go out into the rural, or our divisional teams, to address some of the issues that they face at the operational level. We talked about in our review of our operational plan and our budget last year, we've talked about some of the challenges that they face in our divisional settings. Despite our effort to ensure that our programs run, we faced issues at the operational level. So the intent was that starting this year, that we'll go out. Our senior managers in the Ministry of Health would go out and spend time in our divisional settings, maybe 1 to 2 weeks, to look at how they are actually implementing the programs that we've set in place. Look at the challenges they face, and not just they just sit in head office and they are sending out orders, and there is implementation issues at the ground level that they are not familiar with or they don't understand. So with the leadership of the minister, we've decided, okay, starting this year, we'll go out into the community, spend time with our, not the community, with our divisional officers, spend time with them and look at the issues that they're facing, the challenges in implementation, what are some of the bottlenecks that in operation that they can clear. And they make use of the opportunity to be there. While they are there, solve the issues that our operational staff are facing, clear the bottlenecks that are there, so that when they come back and sit at head office, they have an understanding of the operational issues that our people on the ground are facing. So we've started this year, and we've started in the North. And in fact, the minister has been there for the last 2 weeks, touring the North. And then early this week, we'll get our teams, our senior managers, to go out to the North. They deal with the finance, with the human resource, with supplies, with medicines. So all those challenges, they'll be out there talking to the people on the ground and addressing these issues. And it just happened that we also decided that, okay, while everyone's there, we'll have the farewell for Dr. Fong. So Dr. Fong is, everybody knows Dr. Fong. Dr. Fong is a senior health official in the Ministry of Health, in health services in Fiji, having spent more than 30 years. A colleague of ours, so we decided that, okay, while the heads are there, we can make use of the opportunity. While we are still there, we farewell Dr. Fong, who's also from Honolulu. So it's appropriate that the function is held at Honolulu. I've been told that there were discussions that it's held in Tagondravi. No, it's held in Labasa. And it's happening on the same day or the week that our senior managers will be there. So that's the sort of the arrangement that's in place. And that program continues. We'll start in the North, then we'll come to the West, where our heads are going out, and then we'll come to the Central and then the Eastern Division. So it'll be between 1 to 2 weeks. Our heads will be going out, spending time there, and they'll do this program, and then they come out. So hopefully, the outcome that we're looking for is at the operational levels, the implementation obstacles that they are facing would be ironed out. Okay? And any bottlenecks that they used to face will be clarified and hopefully cleared, so that we can see a smoother implementation of our program, but also importantly, the utilization, prudent utilization of our resources. You talked about The use of government funds, taxpayers funds. So the only use is because our teams are out there. Our heads of village are out there. So the cost of those are coming from their cost centers. Other than that, we are abiding by the Ministry of Finance instructions. There won't be any taxpayer funds to pay for food or accommodation or anything like that. The contributions are voluntary. We're not forcing anybody to cough out money. If they don't, contribute, that's not a problem. It's just from the contribution of the staff. The voluntary contribution is what will base the function, and so that's happening. It's scheduled for the 26th of this month, and that's towards the end of the week, where our senior health officers will be in the